Kamala Nehru Memorial Hospital was set up in 1931 and initially served as the Congress dispensary. After the death of the founder in 1936, Mahatma Gandhi, along with national leaders, were determined to make the hospital's work carry on. The initial funds for the hospital were collected from all over India. When it opened, the hospital had only obstetrics and gynecology units with 40 beds. The hospital has grown steadily over the years and is regarded as an important center for mother and child health care and cancer treatment. It now has 306 beds and conducts outreach and awareness programs, health education, health awareness camps, vocational training, and rural health. KNMH has a mission of offering healthcare services to all of society, especially the underprivileged. Its vision is to utilize academic medicine, teaching, research, and clinical excellence to provide the highest level of care and medical innovation. Success factors of hospitals and healthcare organizations are measured by both their influence on society and the amount of people they serve, as well as their financial condition. The ability to correctly identify patients' financial situations to determine what prices they qualify for is extremely important. The more efficient this process becomes, the more it has an effect on increasing revenue and decreasing costs as employees and resources become more efficient. Another success factor for hospitals is the number of specialty departments they have. In other words, the more expansive your product and service lines are, the larger your patient markets will be. In particular, specialty departments attract patients that are willing to pay for superior treatment. Having a patient-friendly environment and attentive, intelligent, and passionate employees is another important factor that leads to success. Simply put, the more positive the patient's experience, the greater likelihood he or she will return, which builds brand loyalty. Another success factor is how advanced and state-of-the-art the hospital's facilities and equipment are. People want trust in their hospital or healthcare provider, and more advanced equipment instills superior quality and better accuracy in the minds of customers and patients. Likewise, patients value sanitation and cleanliness in hospitals, so clean rooms, seats, bathrooms, floors, etc. are all important. Lastly, hospital industry leaders have efficient software and databases that reduce patient wait time and help operations run smoothly and efficiently. The value propositions for KNMH customers can be summarized as follows. Patients want superior quality health care at low costs. They need, at the very least, to receive treatment and service, and they fear unsuccessful treatment or malpractice. Politically, KNMH relies on the Indian government and other charitable organizations for funding. In recent years, India has become a developed and powerful nation, but battles a huge income inequality gap issue, which directly rubs off on KNMH. The hospital's strong social and humanitarian values helps its public image, but hurts its financial well-being. It draws patients from neighboring regions and countries that either want free healthcare services or superior quality services in their specialty departments. Currently, the hospital is experiencing an exodus of wealthy patients and an increasing amount of poor patients. Part of KNMH's philosophy is to provide free health care to those who can't afford it, so this trend obviously has hindered their revenue stream. To this point, the hospital has dealt with patient abuse of a very loose system that assesses what prices patients qualify for. Moreover, the hospital hasn't changed their price policy since 2004, so have much lower than market prices. Significant income has been lost here. The hospital also has been dealing with an IT issue. A few years ago, a project was initiated to develop this IT software, but it was recently put on hold due to a lack of funding. The effect manifests in longer waiting times and less efficient operating processes. Further adding to the hospital's operational inefficiencies, KNMH faces an employee attendance issue with an absenteeism rate of over 25% among nurses. The hospital's pharmacy has become utilized less and less by patients, largely due to higher than market prices and improper inventory management. As of now, the hospital has 3 specialty departments that are far superior to their competitors: oncology, maternal and child health, and diagnostics. For cases that fall outside of these departments, patients are willing to travel to and pay more at competing hospitals for superior service and treatment.